sa pag-asa, pinakamalakas na bagyo hindi lang sa Pilipinas kundi sa buong mundo ngayong taon, ang Super Typhoon Yolanda.
Bago pa maputol ang komunikasyon.
Signal number 4 ng pag-asa ang
5 araw matapos humagupit
National Police and Bureau of
at napakalakas na ng hangin.
Nasa 185 kilometers per hour maximum sustained wind.
Nagsimula po ang aming hindi malilimutang
Eastern Pacific, but this one was quite literally off the scale.
The Philippines is one of the countries most vulnerable to typhoons due to its geographical location. It is located on the Pacific Ring of Fire and along the Pacific Typhoon Belt. It is one of the top 10 countries worldwide at risk from climate change and natural disasters, specifically typhoons. The country experiences an average of 20 typhoons each year. Super Typhoon Yolanda or Haiyan was the worst, killing an estimated 10,000 people and displacing millions. It was one of the largest and strongest typhoons ever recorded. It had winds that reached 195 miles per hour. Climate change forecasts indicate an increase in extreme rainfall in the Philippines, with the number of days with heavy rainfall likely to rise between 2020 and 2050 as a result of global warming. Poor people are more sensitive to climate-related shocks and have fewer means to prevent, cope with, and adapt to disasters. Last December 16, 2021, Super Typhoon Rai, locally known as Odette, made its first landfall, bringing torrential rains, violent winds, floods, and storm surges to the Visayas and Mindanao Islands. The National Disaster Risk Reduction and Management Council, or DRRMC, participated on public awareness campaigns, while the Department of Social Welfare and Development provides relief assistance and basic needs. Next is the humanitarian partners under the Humanitarian Country Team shifted gear to support life-saving assistance. Lastly, the international and local non-government organizations or NGOs and civil society organizations are the backbone of this response. The effectiveness of preemptive evacuation, early warning messaging, response of the government and community resources saved many lives.
Now, let's talk about the areas that require strengthening. As we know, typhoon mitigation is very vital because these are actions taken to prevent or reduce the risk to life, property, economic and social activities, and natural resources. Knowing this, in order to mitigate the impacts of typhoon, as a nation, we need to improve our awareness, preparedness, trainings and education, predictions and warning system which can help us to reduce the risk of having disruptive impacts of typhoons on our communities. To achieve this goal, I propose that our government, public and private sectors must organize or strengthen some areas that we still lack in the present. Specifically, first, we need to establish more trainings and seminars to local communities which will hasten the response and recoveries during typhoon. Accordingly, TESDA is providing seminars in areas vulnerable and hit by typhoons and conducts construction-related skills training. Also, our barangay officials are encouraging people to participate, train, and volunteer in case of disaster emergencies. This is actually a good example of initiative and cooperation in our community. Second, we need to upgrade and focus more on our educational system in terms of disaster risk reduction to spread and increase the scope of public awareness. This is necessary since we know that education enhances preparedness by improving risk perception and replaces disaster experience in learning and anticipating risks. With this, I believe that our government needs to fund and conduct more hazard-specific researches which are needed to develop cost-effective methods for strengthening existing buildings and improving our livelihood and available resources. Based on the findings of these researches, it may involve solutions that are technically sound. And through education also, we may teach people how to prepare for impending typhoons to minimize the damages and casualties. Moreover, as we strengthen the areas that we lack, we must recognize that response and recovery is still a coordinated effort of the people, government, private voluntary organizations, and community volunteers. Thus, we must be reminded that progress toward adoption of mitigation practices will require community commitment, recognition of barriers and constraints, and innovative solutions.
Typhoons pose serious threats to human well-being globally. Governments and policymakers are particularly interested in risk reduction through effective risk-informed planning and resilience enhancement. To facilitate this, here are some strategies adopted from the National Preparedness and Response Science Board's Community Health Resilience recommendations. First, strengthen and promote access to public health, healthcare, and social services. Strong day-to-day system can be better leveraged to support health resilience during disasters and emergencies. In capable systems, people know how to access care and are not limited by real perceived barriers to services. Second, promote health wellness alongside disaster preparedness. Information and education that involve public health, behavioral health emergency preparedness, and community health resilience interventions can help people face everyday challenges as well as major disruptions or disasters. Optimal levels of physical and psychological health and well-being within the population facilitate communities' rapid recovery. Third, expand communication and collaboration. Build networks that include social services, behavioral health, community organizations, businesses, academia, at-risk individuals, and faith-based stakeholders, in addition to traditional public health, healthcare, and emergency management partners. Fourth, engage at-risk individuals and the programs that serve them. Engaging individuals with potential vulnerabilities to take an active part in protecting their health and aiding their community's resilience strengthens the community as a whole. Assist programs that serve at-risk individuals to develop robust disaster and continuity of operations plans. A community should develop the ability to use its asset to strengthen public health and healthcare systems and to improve the community's physical, behavioral, and social health to withstand, adapt to, and recover from adversity. Through this, we will be able to achieve enhanced community resilience.
When the risk of an upcoming typhoon arises, there are agencies that will prevent and mitigate its hazards, prepare the people, create an immediate response, and be at the front line of all necessary rehabilitation and recovery to address actual life-threatening disasters and its effects to the people, environment, and the economy. The Philippine Atmospheric, Geophysical, and Astronomical Services Administration, or the PAGASA. One of the PAGASA's responsibilities is to maintain and operate a nationwide observation and forecasting network focused on weather and other climatological phenomena that may have an impact on the country's safety, welfare, and economy. A network is used by PAGASA to receive data. They research and analyze these data before preparing and issuing forecasts, bulletins, alerts, and advisories about weather and other flood conditions to the general public, as well as in aviation and maritime sectors. PAGASA conducts research on typhoon formation, development, and its movement. The findings of this research aid PAGASA in developing strategies and ways to mitigate the devastating consequences of severe storms. The National Risk Reduction and Management Council, or the NDRRMC, is a working group of various government, non-government, civil, and private sector organizations of the Republic of the Philippines. It is administered by the Office of Civil Defense under the Department of National Defense, and the Council is responsible for ensuring protection and the welfare of the people during disasters and emergencies. The NDRRMC directs local government units, or the LGUs, of the areas to be strongly affected by incoming typhoons to activate their local disaster risk reduction and management councils and their 24-hour disaster monitoring systems. We also have the Department of Health, which issues an alert memorandum to all its regional health offices and as the lead agency in health emergency management in the country, the DOH regularly monitors the occurrence of health emergencies and disasters, including events that may lead to health emergencies, and operational activities of DOH include the following. We have first health emergency management, which is the collection of activities undertaken in the pre-disaster, emergency or disaster, and post-disaster scenarios with the aim of minimizing the negative health impact of emergencies and disasters. Second is response activity. It is any activity conducted in response to a certain health emergency or disaster. This is including but not limited to emergency response, evacuation, camp management, disease surveillance, relief goods distribution, medical mission, and psychological services.
For the health advisory, here are the things to do if there is upcoming typhoon. Listen to radio or television for weather updates or be updated on social media or internet. Have a first aid kit ready and your emergency kit ahead of time like flashlights, clothes, candles, and radio. Make sure that you have extra batteries. Store adequate food supplies, especially canned goods, biscuits, clean water, clothes, and blanket. Have food that do not require cooking. During strong winds and heavy rains, make sure that you stay alert and watch out on falling debris like falling roofs, tree branches, and electrical posts. When inside the house or building, do not stay near the windows and watch out for broken glass. Remove or unplug all electrical appliances in your home. And lastly, avoid going to the riverbank or seashore. Typhoons and heavy rains may cause flooding, which in turn can potentially increase the transmission of communicable diseases. These include waterborne diseases like typhoid fever, cholera, leptospirosis, and hepatitis A, and vector-borne diseases like malaria and dengue. Climate change affects the increase in the intensity of typhoons. To avoid communicable diseases like what I've mentioned, make sure that during the typhoon, your drinking water is clean and from a safe source. When in doubt, boil your water for 2 minutes or longer, or chlorinate drinking water to make it safe. Here are some of the long-term goals for typhoon. Foster all sectors of the community working together to create a flood hazard resilient community. Ensure that local and state government entities have the capabilities to develop, implement, and maintain effective floodplain management programs. Next is, ensure that the communities in the areas are collectively maintain the capacity to initiate and sustain emergency operations during and after a flood disaster. Next is, ensure that local government operations are not significantly disrupted by flood hazard events.
When any disaster strikes, whether it be typhoon, flood, terrorism, tornado, or fire, the situation has the potential to create chaos and confusion. Effective disaster preparedness helps alleviate some of the chaos brought by the unexpected crisis. It is critical to have a plan in place and for all members of the community to understand their role within the plan and be revisited regularly. If most are following the disaster plan, it is possible for help to be able to get back up and running quickly and begin serving the population affected by the disaster. Remember, to be prepared is half the victory.